On this episode of Athletic Training Chat, we have Dr. Zachary Winkelmann, and we are discussing the transition to the Masters. And really, South Carolina has done something interesting where they still had a post-professional Masters to offer that to undergrads who had finished up their undergraduate degree in athletic training, but also the entry-level or professional master's program. Talk a little bit about that, how it has been balancing those two. But ultimately, we talk about the transition to the professional master's program and what that has impacted with the profession so far from a professor that's in it. We also talk about patient-centered care and what that looks like in the research that Dr. Winkelmann's been doing on that, and kind of how that builds into the overall way that athletic trainers interact with patients and how it is such a benefit. So really interesting conversation on that. We did want to thank Dr. Winkelmann. He is taking us up on a bulk order for the AT Daily Journal for his class. We're looking forward to hearing how that goes. Fingers crossed everything goes extremely well, but we wanted to say thank you for that. New things happening in athletic training. We interviewed Adam Halpern a couple episodes ago about Wave on Health. Really interesting concept to help manage athletes and patients and really get more access and resources to them if you're having difficulty filling a spot or want to augment the care you're able to provide without putting in more hours. If you follow him on LinkedIn, he's got it, and social media, there's some interesting articles he's put out about the future of athletic healthcare. Please check that out. If it's something that's interesting to you, please mention that you heard about it from the AT Chat podcast. We'd appreciate that. It sounds like it could be a really interesting solution to a lot of potential issues and current issues that we deal with as a profession in terms of just being able to provide the level of service and care that we want to, but not having the physical capacity to do so. Then, as always, we are powered by Mueller Sports Medicine. We can't thank them enough for their help and support. And without further ado, please enjoy this episode. Well, welcome to this episode of Athletic Training Chat. We are on with Dr. Zachary Winkelmann, who is a professor in the athletic training program down at the University of South Carolina. We connected over the Athletic Training Daily Journal. They are going to test it out there in the program, see what the students think about it. So we were just discussing offline how it was a little bit of a runaround to physically get them to them as boxes were delivered all over campus, but we made it happen. But we're going to just talk about the transition in the athletic training degree and some patient-centered care, just a lot of things that are big in the profession right now, all across the board. But before we get into all that, I wanted to turn over to you to fill in kind of background on who you are and how you got to where you are now.
Yeah, thanks, Joel. I'm Zach Winkelmann. I'm a clinical assistant professor here at USC, as Joel shared. I'm also the clinical education coordinator for our post-professional program. And so we have two professional and a post-professional program here. Originally from Texas, and went to undergrad at Texas Lutheran University, and then did my master's and my PhD at Indiana State. And then this is my first big boy job, if you will, since finishing my PhD. So thank you for having me on.
Awesome. You have a plethora of experience in AT education, just, even from what you were saying, with your two different degree paths currently at South Carolina. And then I believe timing worked out with some experience also in the bachelor's program. Yeah. How do you see, how have you seen the transition? Obviously, that was a big topic for a long time, still comes up from time to time as, we're probably not far enough in it to make any real determinations yet, but just if you wouldn't mind kind of giving your perspective.
Yeah. Doing the undergrad bachelor's route and then a post-professional master's myself, And then while I was at Indiana State, I was fortunate enough to watch through the process of them starting and developing the DAT program at Indiana State. And then coming here, and it was the last class of undergrads for their professional program, and then the start of the professional master's program at South Carolina. So I've been at places during those transition periods and phases, and it's been really fun to kind of watch that. And we're in the process right now currently of creating a new post-professional route here at USC. And so a lot of cool opportunities are emerging. It's been interesting to see how it's been received and from each of the angles and profession in our profession. So I think holistically, if you will, I think clinicians were a little confused of the need for the transition. I think educators on the other side were like, this is essential to what we're doing or trying to do. And so it's been interesting to kind of see what that looks like. And I think on the people that are on the hiring end, now they're saying, well, what do we need to do with this? What is the expectation or the value we should be expecting from a person with a professional master's or a DAT now? So it's been kind of interesting to watch that kind of since 2015, kind of around that time when the white paper first came out about should we make this change, to now then introducing the new standards, to now all the programs at the transition point. So it's been very interesting.
What advantages have you seen so far in it? And
Yeah.
then your guys, are you somebody comes in with a 4-year and then you're a +2? Is that your current setup?
Yeah, so we have a 4-year degree requirement, and we're a fully master's program, so we don't have an accelerated degree.
Gotcha.
So our program, we are seeing a big benefit in terms of the background knowledge. So people are coming in with a lot more experience or expectations of knowing what they're getting themselves into. So going through their undergrad degree and getting observation time or experiences at clinics or their undergrad institution, I think most students know what they're actually getting themselves into when they apply to an AT program now, which has been extremely beneficial in the retention and them getting jobs and staying in our profession long term. So I think their expectations have been good. And then on the flip side too, once they're here, I think the maturity level is drastically different. The students are bought in 100% to being devoted to AT. So they're not having to take English or worry about a chemistry lab and how that conflicts with clinicals. Like, it is only AT and going to clinical experiences. So the benefits definitely are there from the perspective of knowing what they're doing and spending the time only doing that we're able to craft them. So while it went from a 3 to 4 year degree at the undergrad route to 2 years, you got to think about the amount of classes that you're taking at the undergrad level. And really the degree itself doesn't really change per se in terms of the amount of credits. It was just your undergrad degree being 3 or 4 years, you were taking so many like gen ed or additional classes that you had to take. And so being able to focus in on just that information has been really helpful. And I think we've seen that benefit on the BOC and people staying in the profession.
Yeah, just seeing some of the classes when I was at the D3 school, we were in the transition phase when I was there, and I was not on the academic side, but they invited me in just to be kind of a part of it, which was nice to see the process. But some of the
Yeah.
classes and the coursework that they were talking about offering, I was like, well, can some of my staff sit in on some of that? Like,
Yeah.
it was just kind of cool that you were able to get deeper into some of the things that, yes, you covered in your undergrad, but as you mentioned, it was slamming a lot of stuff in and still trying to work around all the other things. And so I can imagine uh, academically how much better prepared people could come out of that.
Yeah, I totally agree. And I think I've had the same experience since teaching here. We have quite a few of our preceptors or people around the Columbia area that are like, hey, I saw this picture on Instagram. You were teaching this. You think we could come by? And I'm like, yeah, let's set up a time. So
Sure.
it's been kind of cool to share that kind of new knowledge or the stuff we're teaching our students to also the people around the area and trying to make everyone better. And that's been stuff that we've done at our state conferences. We hosted a big like simulation-based learning lab at our state conference. So not only sharing it with our professional master students, but also thinking about all the certified ATs that are out there that maybe not had that expectation or requirement when they were in school, and thinking about what that looks like for professional development too. So it's been an interesting change and transition, but I think spending the time on those areas and dedicating it to it has been extremely beneficial to the students when they leave and graduate.
You said, you mentioned you had the last year of the bachelor's when you got there, and obviously working with your other colleagues. Have you guys seen, has that led to better job placement, better opportunities in terms of compensation? Because that's again, all we're
Yeah,
hitting all the hot topics in athletic
yeah,
training right now. Because I know that's always been, when I see it on social media, is what is it truly meaning, and what is that, what is entry level, and
yeah. It's been I think like I'm excited to report that 100% of our students have jobs, and they are wanting to stay in that AT. And so from our perspective here at South Carolina, the students are getting jobs that they are wanting to go into, and it's not that they are having to settle. And I think that's where it's been a different conversation than maybe in the past, where it was like, well, this isn't really ideal, but maybe I can do this. And we're now at the point that I think our students are learning how to leverage their education, negotiate, and think about what they need to do to be successful in the profession and stay in the profession. So a lot more of those hard-hitting questions for employers about, well, what's this going to look like in terms of my work-life balance? Are y'all thinking about student loan repayment? Those are things where I think employers are going to have to start thinking differently if they want to fill the jobs that they have. And it's not that their people aren't out there looking, it's that other places are providing them better opportunities or different opportunities that are meeting their needs. And I think our students are, at least in our program, we're telling them to look for those things, and that those are going to be independent per person, but it's the stuff that is going to make you happy and healthy at the end of the day. Some people have taken, those internship routes that people maybe not always advocate for. And I think we've learned that, the students are going to figure out the place that's going to make them the best in their future down the road. And we just want to be open and transparent with them about that process and what that looks like. Other people are like, I'm going to wait until I find the best job possible, and I'm going to interview at all these places and figure it out. And then I think others have been had that experience where they've had 3 or 4 job offers straight out of a professional master's, and they're like, I get to pick now. And I'm like, yeah, it's kind of cool, right? And so
not
it's
not
been
something I had when I graduated, unfortunately.
yeah, same. Like I had the GA experience, and going straight from there into finding a GA and a master's program, I was like, God, I hope I can get in one. Like I need to go somewhere. And
Yeah,
it's been so interesting to see them feel like I'm ready. I can go work. I don't need to do a GA experience. I don't need to do an internship. I can be a full-time employee. And I look back when I was an undergrad graduating, like it felt ready, but I felt like that was always the unwritten next route, that you were always like you were
absolutely,
expected to go be a GA. And
totally.
that conversation's changing.
Yeah, I joke, and it's not a slight, but I did. My grad school was a GA position with a side of a degree. Basically, it was going for the job and the experience with the degree on the side.
Right.
It's kind of how it worked out. It definitely wasn't the priority.
Right. And I think that's what I've enjoyed about teaching in a post-professional program at the same time. So we have 2 master's programs currently, a post-professional and a professional master's, and our post-professional master's is really trying to find ways to incorporate your clinical education, but also actually advancing your knowledge, that it's not just you're here to take a class and move
Sure.
on, that it's actually complementing your clinicals, or you're thinking about things differently and expanding that breadth and depth of your knowledge. And for some students, we're also having to like level them up to where professional master's programs are teaching, that their undergrad program may have not taught some of these areas, and we need to fill in those gaps so they are at the same level or playing field as some of those students graduating from professional master's programs, that you can be competitive in the marketplace the same way with coming out of those programs still. So it's been a fun ride and opportunity to have both of them at the same time.
Is it, I don't stay clued into the educational side
Yeah.
too much. Is it common to have both? Do you guys see that
No,
post-professional? Do
no,
you see that
I
post-professional lasting for a while, or is that the plan to kind of phase that out as you just
yeah.
don't have, unless people want to go back for a second master's degree after they get their professional one?
What does that
Yeah,
look like for you guys?
yeah, I think we are the only place that has both master's programs
That's
currently. There
fair.
are places that have professional masters and then DAT or PhD options.
Sure.
Other programs have like a professional degree and a certificate option, something that's a post-professional route. I think we're the only place that has both master's programs currently. I could be wrong, but I feel pretty certain on that. It is confusing for people, and so that's where we use the terms professional and post-professional, and we try to break it down because everybody's a grad student then, everybody's a
Sure.
master's student, and so but yeah, this will be our last cohort for our post-professional masters
Okay.
that we're admitting right now. And that's just because the undergrad programs are finally phasing out. Those juniors and seniors are the last couple cohorts to graduate from those programs. And we felt it was important to provide them options that
Yeah.
that everybody else had, that you don't want to leave them behind or felt like they were forgotten about. And so that's why we've kind of hung around for options of places that have longstanding undergrad programs, still graduating large cohorts, 20, 30 students from some of these places of the kids we're interviewing right now. So it's been
Wow.
there's people still out there graduating from those undergrad programs. And so we will be transitioning to and trying to find a new post-professional route here. Stay tuned for that.
Sure.
And so there will be some new exciting things happening.
This is feels like kind of a loaded question because you probably
Yeah.
don't. I wouldn't say it, but any drawbacks or unforeseen, circumstances or just things that have come up that you're like, we didn't see that coming with the transition over to the professional masters.
Yeah, I'd say the two things that are probably the hardest that we've had to try to navigate or work through, and some are things that are very hard to work through, are one, the cost. The most of the students have had to pay for 4 years of undergrad and then paying for grad school on top, versus where in the past undergrad may have been had to pay for the same way, but a lot of times our master's degrees were paid for through GA positions and things like that. So that's been a definite hard area for that, especially recruiting out of state or international students because it's expensive. And so finding creative ways to reduce those costs or find financial aid options for people, that's definitely an area of concern. And I think the other part, which is really hard to navigate, is the mental health piece. So I think for this transition time came at the most unpredictable event with COVID, and it can't describe the transition without that piece. So is the job situation because of COVID? Is it because of our degree transition? Is it because of athletic training as a whole? Who knows? And
Right.
I think it's so hard to discern one of these things as the true factor. But I think that's trickled over into our students. So we have to remember that they were the people in undergrad during COVID, that their experiences, that these early new grads right now had disrupted their undergrad experiences. They missed out on big opportunities in those lives. They took anatomy online. And so for us, it's having to almost make sure that they are knowledgeable in those prereqs or those baselines and feel okay coming into our programs, and then really assimilating them into like everything's face to face. You're going to be thrown into patient care every day, and kind of helping them navigate what that looks like in terms of high patient load, doing class plus clinical, which is a new concept for them. And so it's been I would say that's probably a piece that I think we as education need to focus a little bit more on, is what mental health looks like, accommodations for people, and understanding our learners are different now.
How do you? I just out of curiosity because that is a huge thing. How do you guys address that as a program? They're again hardliners. That it's the hours. It's just part of the grind, and it doesn't feel like that quite works anymore.
Yeah.
Like at all, and that it seems like that is a losing position if that's the side of the battle you're going to try and pick. People are going to find another option, another way that works. I know just looking around at different things, like hours wise, there's a group that's hiring full time, but you work 4 days a week, four and a half another week, and
Yeah.
that switches, and they're like, we consider that full time, and we want it to be,
Mhm.
for all these other reasons, which obviously depending on the setting that it may or may not be feasible, but how have you guys accommodated that, finding that balance of, understanding what the profession, depending on setting, can put you
Yeah.
through, versus obviously the well-being of the person.
I think one of those big things that the degree transition really helped with in that process are the clinical immersion pieces. And I think the term gets thrown around a lot, and maybe not all of the practicing clinicians or preceptors really understand the difference there. Clinical immersions are an opportunity for the students to be placed where they're seeing the totality of the job. And so rather than coming in at 2:30 after class got done, you stay till into practice, you're at there only doing clinical, and you're going to, you have a meeting with the coaches on the injury report, you're going. When you take a lunch break, you take your lunch break. When you need to place a budget order, you're helping with it. And so it's rather than like shielding or yielding people to like, oh, I don't want them to see this, or this isn't the fun, cool part of AT. They need to see the whole perspective of what they're actually going to be doing. And I think
Sure.
that's really helped. And we have 2 of those in our program. So we have a 3 to 4 week immersion in the summer. And that still allows us to get some of those traditional like summer internships and experiences like NFL and things where people really want to try it out and see if they like it. And then the other one, we have a 16-week immersion, their last semester of the program. And so we intentionally put that at the very end, that it's like, now that you've learned everything and right before you start applying for jobs, make sure that you understand everything that you will need to do before you go into that. And we found that it's been highly successful in terms of mitigating that imposter syndrome, or I don't have any confidence, I don't really know what I'm doing. And for us, that's really helped with like the wellness of them as a person, that those immersive experiences have allowed them to kind of see the whole perspective and say, hey, I actually do know what I'm doing. It's kind of cool, and put it all together from that perspective. And I think throughout the whole program, we just try to check in on our students and see them more as people than as a workforce, if you will, that they are genuinely people. Like, we need to make sure that they are happy and healthy and able to succeed, and use those resources and referring them out when necessary. And for us as faculty, not take on all that too, that we aren't their therapist, and we need to recognize, refer, and treat them the same way as patient care does too.
I like that approach. I like that mindset. Uh, this is the question we always ask at the end, but specific to the educational setting and impacting the profession in the future, if you had your crystal ball, what do you see this impact over the next years?
From AT as a whole, or?
Yeah, or I guess both. Like, from the educational side, do you see, big trends that might be
Okay.
coming?
Yeah.
But then, yes, globally as a
Yeah.
profession, if you can tackle both.
I think a trickle down effect hopefully will happen. So I think if AT education starts to try to do some cool new stuff, hopefully that translates to clinical practice, because ultimately that's what we're wanting to do at the end of the day. And I think this is where the mindset of like educators versus clinicians always happens. And you see these
Sure.
slides on Twitter, X, whatever we're calling it this week. And those are parts where I struggle. Like, I am a athletic trainer. I am still certified. I can treat a patient. I can do this. I meet with our students all the time about patient care. We sit down and say, well, why didn't you do this? How didn't you do this? Or exploring case studies and getting that knowledge. So I think it's really important for anybody listening to know that educators have to be clinicians. We have to be certified. We have to stay up to date. And the same respect goes for clinicians, is that as educators, we need to understand that they are seeing different perspectives and ways of doing stuff every day. And so that needs to be more of a symbiotic relationship there, that it can't be them versus them, it needs to be us. And that what we're teaching needs to really trickle down and change during patient care. And that's been a lot of my research area in patient-centered care and telemedicine. Like, just because we're doing it on the research or teaching side, we need to see people do that actually with patients. And I think that crystal ball, that big thing I would love to see is actual interprofessional practice happen. If that could actually happen, would be really cool. Not you calling your team doctor because you had an injury, but truly people maybe referring a person to an AT. Like, hey, I have this patient. I think it would be great if they saw an athletic trainer, or the school nurse consult with the AT, not the AT say, hey, this kid got injured, if you see them during the day. Like, actually working together collaboratively, like you would see and say, an emergency department at a hospital. Like, I think that'd be super cool. There's been a big push for interprofessional education and interprofessional collaboration within the new CATIE standards. We have an entire course on it here at South Carolina that they take it with a group of 500 students from campus that are all healthcare disciplines from 13 different majors and areas. So the School of Medicine, nursing, genetic counseling, athletic training, a whole bunch more. And it's so cool to see them like learn from and with and about each other and learn about their roles, their responsibilities, their big myths about like, oh, well, we get thought about this way too. Like, no one knows what you do, no one knows what we do. And so it's interesting to put them all in a room together and see those times happen. And it'd be awesome if that actually trickled down to patient care then, because I think it could change our outcomes drastically.
I appreciate that. Before we jump into, you almost perfectly led into the, your research on patient-centered care there. Anything else around the kind of transition that we didn't cover that you'd like to touch on?
I think the biggest thing is I think people just need to maybe understand like those educational pathways and terminology matters. Like, that's a thing I share a lot, is like the words actually do matter. So when we're talking about like AT residents or AT fellowships, those are going to be actual things. Like, there's residency and fellowship programs that are CATIE accredited. They are training people to be specialists. Those are those new post-professional pathways and routes that are out there. And I think for a lot of people, they don't know what they are, or we just use those terms to describe people and don't know maybe what they mean. And so I think there's a lot of areas for us as a whole, as a profession, to share more about what the changes mean and how those routes look. Like, what's a DAT versus a PhD? What's a residency program versus a specialty certificate? There's a lot of things that I think we just need to better educate everybody about, so they know what routes are out there and how those work. And then for employers or people listening, be very careful or mindful of what you're calling your programs or your employees. Those things matter. And so in trying to level that up and understand that they do know more. It's not that you're less, it's just they were trained differently, that the students coming out of professional master's programs are exposed to so much more than I ever learned. But it doesn't mean my undergrad program didn't prepare me well. It just looked different. And I think that's where we got to see this as a benefit to everybody, and not something that, well, they're trying to make me not look as good. And I think if we can maybe shift our mindset there, it could be really beneficial.
Makes sense. Appreciate that. Like you mentioned, your research on, patient-centered care or the patient-centered environment. Could you define exactly what that is?
Yeah. So it's been I think I use it as like a whole encompassing term.
Sure.
The CATIE has kind of 5 standards underneath our patient-centered care kind of domain, if you will. And as the CATIE uses it, those include things like social determinants of health, health literacy, advocating for your patient. And so those are things that often pop up under there. As a whole, though, patient-centered care is being respectful and responsive to a person's desires and needs, and then using shared decision-making, meaning that you and the patient are creating a care plan together rather than clinician-directed, that you are doing this, you need to come and do this. And so patient-centered care is more about, say, access to care, education, continuity, involving their family and friends. Those are all the aspects that I think if we can spend a little bit more time on as ATs, we maybe won't be as frustrated when things don't go as well with a surgery or an injury, or why didn't they come back and see me? That's the one I hear the most, when people are like, I evaluated them and then I never saw them again. Well, did we think about all the other stuff going on besides that they actually had an ankle sprain? And so those are the stuff that I try to work on and explore through my research.
That was one of the kind of follow questions, and I had, and based off some of that definition might switch a little bit, but
Yeah.
You mentioned creating that shared, treatment plan. I've seen people mention it, and I like how it said, meeting your patient where they are to a degree. How do you balance that from your perspective in terms of doing that, but still doing what you found to be successful in your experience and your training and so on and so forth, and not necessarily just certain patient walking in saying, I need this, and this is what we're going to do, or oh, I don't need rehab. I just want the feel good type stuff. And,
Sure.
sure, you could argue that's patient centered care because you're doing what they value, but at the same time, maybe not exactly what you have
Right.
found to be the most effective.
Yeah, and I think that's where that EBP model comes in. Like you take your best available evidence, your patient's own
Sure.
needs, and then what you think is best. And I think for me, I couldn't share this without shouting out my mentors from Indiana State who kind of instilled this in me when I was going through my master's program. But really, in patient care, the way that I've done this to implement patient-centered care is really providing options with
Mhm.
influence, if you will. So the
Sure.
way I like to describe this is, say someone had an ankle sprain. I try to provide three options to them at the end to try to create that care plan. One is you can do nothing at all. Here's your diagnosis. If you wish to not be seen again, that is totally fine. That is an option that's on the table. However, that may be that you develop chronic ankle instability or osteoarthritis down the road. There's potential that maybe you have some limitations in range of motion or strength. And then maybe your return to play activity timeline may be delayed, could be 2 to 3 weeks. So that's option one. Option two is you can maybe come in a couple times during the week. You can maybe walk on it and maybe not take my recommendations here, but you could engage, do your treatment at home, do some of that stuff. And that option there maybe look like a maybe 1 to 2 week return to play timeline. Option three, which is the one I recommend to you, is I would like to see you at least 4 to 6 times this week. I would like to do some rehab that involves X, Y, and Z. This is what I would like for you to do at home. And then I like for you to use these crutches or boots, whatever it may be. And if we can do all those, I'm hopeful that maybe a 7 day return to play is possible for you. And so providing those options that allows them to see how things could be and what the prognosis may be, but also influencing them through how you're describing those options to them. So I'm not telling you, think this one's the best. It's what are your goals as a
Sure.
person? And these are how these options align with those goals. So if you don't care about returning back to play, option three sounds like a great one. But if you really care about playing the game on Friday, option one sounds like the best one. So kind of use those to try to meet the patients where they're at in terms of their individual perspective. Because I think as ATs, we think everybody wants to return to play, and that's not always the case.
True.
Yeah.
Yeah, I always try to back up the what with the why and
Yeah.
with that
Yeah.
ultimate goal in mind and on like a day-to-day basis, I always we can do the feel good stuff, but you're gonna join me in some rehab, in order to kind of I don't want to earn your way to some of
Sure.
those things, but then I always like the unless I had some super specific reason for a specific type of say soft tissue work, because there was something I wanted to accomplish that would be an option I'd always give them is, hey, we're going to do some version of soft tissue work today,
Right.
with this. What is your favorite? What makes you feel the best? Is it
Yeah.
using the tools? Is it using my hands? Is it using cups or whatever it may be? If I didn't truly have a reason for going one way or the other and
Right.
kind of giving them that like, oh, I would rather do this today. Perfect. Let's make that happen. And that always seemed to help at least get them to feel like they were being included in that process.
Yeah. The buy-in can definitely change from that perspective.
Didn't have a whole lot of other follow-up questions on the patient-centered care, but anything on that before we jump into the AT chat questions before I turn you over to 3 hours of interviews?
I think the part that I would just recommend to people is that when you look at all this, you may have not been trained on how to explore social determinants of health or how to assess someone's health literacy. And so understanding there may be things that you need to learn on how to approach patients from different cultures or backgrounds, why it's important to maybe use pronouns or think about these things differently. And as you do that, I always share with my students, smart, small, but think big. So what's the smallest thing that I can try to do and implement right away? And I can get really good at doing that. Sometimes for my students, that's just sitting down to have a conversation versus standing up over the patient. So
Sure.
just start there, start super small, but think long term. What am I actually doing by sitting down in this chair? How am I creating an environment that looks different? Or how by putting my pronouns on my name tag did I maybe validate somebody that has been misgendered their entire life? So there's things like thinking big, even though the actions may seem small, could really be change your perspective there. So just encourage people to think differently and keep exploring. I think there's a lot that we all don't know about different people and different backgrounds, and it's super awesome to sit down and learn different perspectives about different cultures and things like that. And the only way we all can maybe approach things differently is to take time to learn. So the community you live and work in, take some time to drive down a different street or a different area, call a different place to check it out to see how it's a little bit different. And so push yourself into those uncomfortable settings and areas.
Yeah, I learned it's always good to ask in terms of some things too. I used to have
Yeah,
student athletes like that when they had an injury, and I would say, how much do you want to know about this? Like, do you
sure.
want like the full on depth because they happen to be an exercise science major and are thinking about becoming a physical therapist, and they want all of that. And
Sure.
then other ones that are just like, nope, do what you do, like tell me what I need to do, like I don't need the details. And
Yeah.
so then I didn't bore them with it or speak over their head. We met them where they wanted to know, and we went from there.
Yeah, I
Which
agree. I think those are helpful. But ask, like as you said, you just got to ask that question and see what
Sure,
the person wants. Because if we assume that, oh, you're exercise science, you already know all this, versus you're exercise
right,
science, but you want to know more. Those are
exactly.
the things where just start the conversation and dive into it with them.
Agreed. Jumping into the AT chat questions,
Yeah.
you can set the example for this because we kind of already talked about it, but just where do you see athletic training going in the next 5 to 10 years?
I think I hope to see that we continue to engage with people from our traditional settings. That I think we need to remember that the college and the high schools are kind of our home or our foundation, and that we continue to see that, but also exploring how we can take care of people that are part of work life and sport. I think that's been some of the coolest areas I've been able to engage with. Dr. Kent Games at Indiana State, when I was there, I got to work alongside him with the firefighters, seeing people from like the ballet here in Columbia. It's just been really cool to see how athletic trainers can really take care of people from so many different walks of life. So I hope we are able to see that. And then as a whole, public perception, I hope that we are able to be that when someone says a PA or PT, I hope we get to the point that we can just rattle off AT and people know what it is.
For
That's what
sure.
I hope for before I retire from this profession.
I'll happily help join you in that goal. So if
Yes.
you figure out
Let's do
ways to
it.
do it, you just let me know. I'll jump on.
Let's do it.
What advice would you give yourself as a young athletic trainer if you could kind of set when that would advice would be given?
I would learn to say no quicker, earlier. The advice I give to all of the graduate assistants now as the clinical coordinator for the post-professional program. So I oversee 36 students as part of their GA positions here.
Okay.
I wish I had that advice, and I wish I had told people I needed that advice. And I think that's been the best thing, is that it's okay to set limits and boundaries. And it's not always having to say no, but it's saying yes, but not right now, or things like that, it's important to not pour from an empty cup, if you will. That I think we talk about this all the time in athletic training, but actually doing it.
Right.
And I think that's stuff that I've done as an educator now, that I needed to not forget that as I change job settings or change my role, that those things still apply. You got to set yourself boundaries and limitations, and that being a people pleaser doesn't get you to the finish line any faster. And so thinking about what that looks like for you and making sure you stay true to yourself in that process. So I wish I had a little bit more motivation or self-worth to say no to some of those times.
I feel that one. I don't feel like
Yeah.
that clicked in until last 5 or so years. And,
Same.
that
Yeah,
I'm 14 years into it. And yeah, man, how things would have maybe been a little different.
I
Um,
agree. I totally agree.
what has been the most influential resource that you have found in your career?
I think I'm gonna give two.
Perfect.
One is the finding stuff outside of AT, but that's healthcare. I think those have been transformative to my practice. So I do telehealth and telemedicine as well. And getting into that back in 2017 before the pandemic, like
Sure.
there was nothing out there for athletic training and telemedicine. You would Google it and there's nothing. And so I was like, well, where do I turn? And so that allowed me to find all these organizations and resources and stuff. The same has been true of social determinants of health in that area that, well, we didn't really have much. So I got to find another stuff. So I think not always learning or looking back at like resources from, say, the NATA or our textbooks, like look at other peer professions and how they're doing it and figure out how you can translate it. Those have been some really great resources. And I think other times I absolutely hate networking at conferences. Like I hate talking to people that I don't know. And I know
Sure.
everyone says to do it, but it's just it sounds like the worst possible thing to do.
It's
Um,
always awkward, and where do you start?
Terrible.
Oh,
And so I think finding a person and to be the wingman has been the best resource. So, or wingwoman too. So that
or start
person
a
that says
podcast
like,
because it automatically sets you up for like sort of knowing everybody, and then you can
right,
kind of meet in person.
like,
So
hey,
yeah,
I
yeah.
saw this, I heard this.
I'm not gonna
But
lie, it's been a benefit.
having that person to kind of take you alongside and say, let me introduce you, I think has been really awesome. And those have created and branched out some really awesome relationships. So I think those have been really good resources, people that genuinely care about mentoring you and developing you as a person and a professional.
I like it. Speaking of boundaries, as an AT in your role, how do you take care of yourself?
So I have set pretty firm boundaries that when I leave, I leave. So like when I leave work, I still have emails on my phone. I check them, I respond way too quickly. But when I go home, I actually go home. So like I need to check out and check into my house or my dog or whatever I'm doing that night. And so spending time with my friends is essential. And I have friends that are non-ATs, and that's not to say my closest best friends that are ATs don't matter to me, but spending time around people that are non-athletic trainers
Sure.
is super fulfilling. They don't know what I do, and so they don't ask, and it's amazing not to have to talk about work. And so I think those have been really great. And then finding times to just engage with other things that are can bring you joy. So like going on nature walks or hikes around the area, going down the river, and stuff like that are things I enjoy to do. So I think just filling the time with positive things around you can be really helpful.
You could change or eliminate one thing, could be a modality, a common practice, a mindset, anything of your choosing in the profession of athletic training. What would it be?
Loaded question.
Yeah.
I think the thought process of I'm gonna throw one out there. Ultrasound. I just don't think it works. There's no way those little bubbles are forming. Like it just doesn't. I can't believe it. And yeah, the process or thought behind ultrasound, like I can't get behind it, and it always makes me laugh when people go on like site visits or go out to see my students, and they're over there just spinning the little transducer and moving around. I'm just like, there's nothing going on. There's no chance.
Yeah.
And I learned about it. I used to use it, and I think the more and more I spent time like wondering like how is it actually working, it made me think about and question it a little bit more. So that's one I would probably throw out from my tool shed, if you will.
Fair enough. Yeah. I would only use the ultrasound head as an active electrode for a combo therapy, and that's about
Yeah.
my time. And I'd flip the ultrasound on because you're already doing it anyway. So what does it
Right.
matter? But if it wasn't with that, I wasn't using that. Also, just like you said, time consuming to just sit there and do your little
Yes.
concentric circles, which didn't always work.
Right. And you can't forget to keep moving it because then you're going to burn the patient or something's
Right.
not going to go well. And then the machine already costs so much money. So there's just always so much pressure to do it just right. Yeah. So I'm fine throwing that one out.
Fair enough. What does being an athletic trainer mean to you?
I think it means giving back. To me, my role currently as an educator, I think athletic training is something that I often can't or don't want to leave. Like my PhD is in curriculum instruction, so I easily could go into a different job or a different facet of education as a whole. Like I don't necessarily need to stay in athletic training, but it's what I know and it's what I believe in, and I truly think there's a purpose for our profession out there. And that's giving back to populations of people that maybe haven't been cared about at, say, like high schools, these group of people that have been overlooked in the industrial setting. I think there's so many things that we give back. And as an educator, my thing that I like is giving back to people, instilling that knowledge or the way of thought into people and saying, just think about these things differently. You're already awesome. Just try to think about how we're doing it a little bit differently.
I like that. If anybody wanted to reach out to you, connect with you, follow you, what would be the best places to do so?
Yeah, probably on Twitter/X. It's at Zach Winkelmann. And then on LinkedIn is also great. So one of those are the best two options.
Sounds good. And we'll link all those up. Appreciate you being on. It was good to, like we mentioned, finally connect.
Yeah.
Instead of via a massive email string, but we made it work. And then to confirm, he does respond to emails very quickly. Appreciate it. Hope I was getting back to you in due time, but look forward to hopefully actually meeting you face to face at some point here in the future, and appreciate it.
All right, Joel. Thank you.
Thank you for listening to this episode with Dr. Zachary Winkelmann, focusing on the transition to the Masters, what he's seen, what they've been able to do at South Carolina. Ultimately, I think it's a really good outlook for a topic that's been hotly debated and goes back and forth. And we're still probably too early to really tell what it's going to do for the profession, but hopefully the right strides are being made in a lot of different ways. With that, we appreciate him sharing that, and also the conversation on patient-centered care and how that works, what kind of the nuances are to that. As always, thank you to Mueller Sports Medicine for powering the podcast and athletic trainers everywhere. If you haven't checked out the Athletic Training Daily Journal, there's a 14-day trial available at clinicallypress.org/shop. You can download for free, no payment required, just really had to house it easily. Check it out on Amazon. Could be a great start for the new year, something if you want to try something new, see what you think about journaling, and have it be tailored to the profession as well. Thank you again for listening. We'll be taking a little bit of a break over the holidays, doing out some replays and whatnot, but we appreciate everybody who listens. It really means a lot to us. We're just here to try and support and make the profession better, so we thank you and are so grateful to meet all of you that are willing to be on. If you want to be on a podcast, it's on a New Year's resolution, let us know. We're happy to talk to you. Until next time, happy holidays, happy New Year.